Hello, everybody, once more. You know already me and Nikolai, so we are very happy to introduce Ellen Griesshammer today. And Ellen Griesshammer, I just read some about Ellen. So she holds a master's degree in Sociology and Public Health and has been working for the German Cancer Society, as in German is Deutsche Krebsgesellschaft, DKG, since 2018. And she's responsible for the European and International Cancer Center Certification Program. So it's, I think, very interesting for us. And prior to her work at the Cancer Society, she worked as an international public health consultant for various stakeholders, including the European Delegation, German Society of International Cooperation, GIZ, and Asian Development Bank. So, Ellen Griesshammer, you're welcome, and please, yeah, we are very happy to have you today in our mammologicum school.
Thank you very much for the invitation. Good afternoon, everybody. It's a big pleasure for me that I've been invited to give a presentation here in this round. I would like to give you today an overview of the quality assurance and improvement in oncology that we have established in Germany. And I would like to start with an overall overview, what kind of infrastructures we have built up in Germany for quality assurance, and then go into a bit more detail into the Cancer Center certification program. If you have any questions during my presentation, I really don't mind if you interrupt me. I'm happy to answer any questions. As I understood, Sergey, you're going to stop me anyhow in case something needs to be a bit more explained and elaborated.
Yes, or if you mind, this is an important point, so you can ask me to repeat it in Russian or something like that.
Okay, perfect. So then let's get started. So first of all, I would like to introduce to you the National Cancer Plan of Germany, which was drawn up in 2008. And within that National Cancer Plan, the so-called quality cycle in oncology was established in Germany. So let's have a closer look what this quality cycle is exactly. So the quality circle always starts with the evidence-based guidelines. So they are developed in the German guideline program in oncology. It's a non-profit program free of any pharma and industry sponsoring, so completely independent, which was important for us. And it basically, the evidence-based guidelines, they define the standard of oncological care per tumor entity. It's at the moment we have 31 guidelines that are published. They're published in German, but in this year it's planned to have all of them also published in English, and they're available for download on the website. For every evidence-based guideline, it is mandatory to derive a set of so-called quality indicators. They're measurable quality indicators, and they are only derived from the strong recommendations of the guideline. We have currently 180 tumor-specific quality indicators available. These quality indicators are implemented in the certified cancer centers. And with this, the implementation of the guideline content is happening. So we can make sure that the guideline content is known in the clinical practice within the certified cancer centers by the German Cancer Society. Every year, so we have a total of 1,789 certified sites in 6 countries that are certified according to the German Cancer Society standards. Over 240,000 patients with the first diagnosis of cancer are treated yearly in certified centers. The certified centers have to document their results of the indicators every year, and these results are analyzed and published in the so-called annual benchmarking reports. So in 2021, we had 13 tumor-specific benchmarking reports with the results of over 250,000 patients. So basically, through those benchmarking reports, the results and the analysis is getting reported back to the certified centers, so they get a feedback, and the results are also communicated back to the evidence-based guideline groups, so they get a direct feedback from the clinical practice, and that information is used then to update and reassess the evidence-based guidelines. And hence we have a living quality circle of oncology established in Germany. Do you have any questions so far to this?
Сергей, здравствуйте.
Добрый день.
Пожалуйста, вот evidence-based guidelines, это что-то типа NCCN, да, вот американского?
Это типа NCCN, да, это доказательная медицина, только немецкая, она называется Leitlinien, как бы, да, то есть то, как мы действуем.
Вот, и все центры на этом базируются. Непонятно, вот что такое бенчмаркинг.
Это когда много центров между собой сравниваются, да, то есть вы можете сказать, что в нашем центре, например, оперируют, к примеру, там 120 карцином в год, а в 20 других центров оперируют разное количество, и у них разные показатели качества. И вот бенчмарк это сравнивает все центры и смотрит, насколько наш центр отличается от средней и от других, да, то есть где мы находимся по отношению к другим таким же центрам, как и мы.
И дальше стрелочка идет в сертифицированные какие-то центры. Это
то есть
это просто аналитический какой-то комплекс.
Не-не-не, смотрите, есть вот эти вот NCCN, грубо говоря, да, то есть в Германии называется Leitlinie. Это на основании вот этих вот доказательной медицины формируются индикаторы качества, то есть количество операций, например, и так далее, и так далее. То есть вот эти вот 180, о которых она говорила, индикаторов, это и есть эти индикаторы, на основании которых мы оцениваем качество работы. Например, у радиолога индикаторы это какие?
Чувствительность и специфичность.
Совершенно верно. Вот, и потом в эти сертифицированные центры, собственно говоря, и проверяются на основании этих индикаторов. Да? То есть индикаторы служат для нас вот этим вот показателем, по которому мы сравниваем.
И отдельный какой-то показатель, который вот этот бенчмаркинг. То есть я вот не понимаю.
Маркет это по всем показателям, например, у Виты специфичность 100%, а у Сергея Поповича 93%, и у всех остальных там 92-94%. Значит, вы находитесь вот в таком-то уровне по отношению к другим. То есть это вы себя позиционируете, как бы, да? То есть насколько вы хороши или плохие. И вам это каждый год делают репорт, так называемый, и вы можете посмотреть, сравнить себя, что очень важно. То есть это все открыто, это все в свободном доступе, и у вас никаких проблем не будет, если вы, допустим, хуже какого-то показателя, но вы уже знаете, что вам есть где подтянуться, и вы для себя вот этот бенчмаркет смотрите, это как бы, знаете, меряете себя по отношению к другим коллегам или там центрам, по отдельным показаниям или по каким-то общим характеристикам, да, это и есть вот бенчмарк.
Я поняла, что это просто система, скажем так, да. То есть это система сама, это не это система.
И она скажет сейчас, что это система самообучающаяся. То есть это то, что вы сейчас видите, это мы же получаем обратную связь от центров, сравниваем. Дальше это все меняется, вливается в систему evidence-based guidelines, они тоже меняются, да, то есть это очень пластичная, самообучающаяся система.
Все, спасибо.
Пожалуйста.
And I will show you some examples of the benchmarking report and the indicators later on. So maybe then it gets a little bit clearer. Okay, so this is basically the overall structure within Germany. Important to mention here is that the certification program is still voluntary in Germany. So not every hospital has to be certified. So in Germany, every hospital is allowed to treat oncological patients. So we do not have specialized hospitals for oncological care. And it's a voluntary system. So not everybody has to join. So this is always important to keep in mind. So it's not mandatory. Okay, then let's have a more detailed look at the Cancer Center Certification Program. So I will briefly introduce who is actually the German Cancer Society. I will explain to you why we started the certification program, what was the rationale. I will explain how the certified center is defined, how they are organized, which criteria must be met, how the results are analyzed and presented. So here we look at the benchmarking reports again, how the audit is organized, and I will show you some clinical studies that can show you how certification can improve the quality of care for oncological patients and why. So the German Cancer Society, here you see a picture of our headquarters. We're based in Berlin. We are the largest scientific society in oncology in the German-speaking countries, including Switzerland and Austria. And our aim is the high quality of oncological care. We're a non-profit and non-governmental, and we focus on the certification of centers, obviously, the development of the evidence-based independent treatment guidelines and patient guidelines as well. We work in knowledge development and knowledge transfer in oncology. We focus on providing reliable patient information. And the German Cancer Society represents Germany in international organizations such as UICC, the European Cancer League, and also within the European Commission. And something where we're really proud of, we are the co-founder of the National Cancer Plan that was published by the German Ministry of Health. So how did we actually, or how did the certification program actually get started? At the mid-90s, 1990s, there was a study on the European level which showed that there are really big differences in the survival rates of breast cancer patients in the different member states of the European Union. And actually the results for Germany were really bad. The study showed that Germany especially lacked the access to highly specialized centers for breast cancer patients, and also that the recommendations from the evidence-based guidelines were not really implemented in the daily clinical routine. So because of this, and with an initiative from the German Synology organization, the German Cancer Society, which is an umbrella organization from all medical associations and societies who work in the field of cancer, were given the task to start a certification program for breast cancer centers in 2003. So we're almost 20 years old. Next year is going to be some big celebrations. In 2008 then, when the National Cancer Plan was published, the idea of the certification program was included, and by 2008 it was already extended to several other tumor entities, and the National Cancer Plan is stating that the cancer care in Germany should be provided in certified cancer centers. So this was a strong recommendation basically from the Ministry of Health in Germany. So what are certified centers? They are defined as the network of qualified and jointly certified interdisciplinary institutions that, if possible, represent the entire chain of healthcare for those affected. Let's take a closer look at this definition now. So, interdisciplinary institution. I brought here the example for the breast cancer center. So the obligatory, mandatory members of the breast cancer centers is from gynecology, radiotherapy, pathology, but also psycho-oncology, physiotherapy, palliative medicine, cancer registries, and self-help groups. So it is a cooperation not only between different medical specialties, but also between different professional groups, and if necessary, between different hospitals or institutions. So as I said, it's supposed to represent the entire chain of healthcare. So the patient at the certified center is always at the center, and then from early detection to diagnosis, treatment, follow-up, and if necessary, palliation, it should all be included within the network. So the idea of a certified center is to build a network with all partners that have joint tumor boards, that are applying unified standards and processes that they agreed upon, that they work according to the defined guidelines, and that they also have a joint data management. And as I said, it could be that all partners of a certified centers are localized in one hospital, but it's also possible that the partners of the certified center are localized in more than one hospital. So that's why it's always important when you hear certified center that you do not think one location, but you really think of a network of partners in different locations if necessary. A network of qualified and jointly certified institutions. Here on the left side, you see an example of what the certificate looks like. And it actually, the meaning of the certificate is that it guarantees a high quality of oncological care, and it serves as a decision-making aid for the patients. So they know when they see that a center, a network is certified, that they will be treated according to the most recent guidelines, and that they will be taking care along the whole journey. So how is our certification system actually built up? Our foundation are the so-called organ cancer centers. These are centers who are specialized in one tumor entity and represent the most common tumor entities. On top of an organ cancer center, there's a so-called oncology center. It includes also tumor entities which are not so common and extends to several organs. As of December 2021, we have a total of 1,162 certified organ cancer centers, 145 oncology centers, with over 365 modules. So like I mentioned already at the beginning, every year over 240,000 patients with a primary, so an initial diagnosis of cancer are treated in certified centers. So our counting point for patients is always a primary diagnosis, not counting patients who have a recurrence. So it's actually more patients being treated in the certified centers. The certified centers are located in 6 countries, and actually with this, the certification program is the biggest and best implemented program for cancer care in Europe. On our website, OncoMap, you find an overview of all certified centers, and then you can filter it accordingly either to tumor entity and to country, and then you find all the necessary information. So this is basically our patient information site. So what is actually necessary, or what criteria has to be met for certification? There is a Word document called the Catalog of Requirements, and there's an Excel document which is called datasheet. In the Catalog of Requirements, for every tumor entity, there is the same table of content, the same chapters, and it's always also structured in the same logic. Here you can see the example from radiology. So for each chapter, you have to fulfill requirements in regards to structure and personnel qualification, in regards to technical equipment, to structures that have and processes that have to be implemented, and also certain requirements for further training and education. So for each network partner, basically, there is a separate chapter in the catalog of requirements. The data sheet, it is actually one of the most important tools for a certification system. Here, the centers have to present their results annually. There are separate indicators for each type of cancer. It's round about always 25. And there's 3 main groups of indicators. So one is about the presentation of the certified network. So it's presentation rate for at the tumor board, how many patients were presented in the pre and post therapeutic tumor board, how many patients did see a psycho-oncologist, how many patients were included in clinical trials and research. The second group of indicators is about the main treatment partner's expertise. So here we look at results of operations and interventions, post-intervention complication rate, etc. And the third one is the presentation of the guideline appropriate treatment. These are the quality indicators which are derived from the evidence-based guidelines, as I shown you in the quality circle earlier. The results of the centers are presented annually in our benchmarking reports, in our annual reports. So here's the example of the for the breast cancer centers. It's a report from 2021. It's the audit year 2020, and the data is from 2019. So there's an anonymized annual report per center. So there's the results of all the centers, but you cannot see which center reported which data. But then there's also an individual annual report, which is given to the center where they can see how well they are doing in comparison to the others. But this one, it doesn't have to be published. It's for the center to keep. And here is one example of a page in the annual report. So here it's discussion of cases involving local recurrences and metastasis. So on the right-hand side, you see the definition of the nominator and denominator. You can see the target value, the rate. So you have to reach over 70%. On the bottom left corner, you can see how the indicator developed over the course of time, so from 2015 to 2019. And here in the bottom corner, you find the reasons given by the centers why they did not meet that indicator. So the goal is actually not to always 100% meet all indicators, but rather to analyze why you did not meet it, so that you keep good track of your patients and you know exactly, okay, why did this one patient did not get the recommendation from the evidence-based guideline? There are good reasons. There could be comorbidities, there could be incidental finding during a different operation. That's why the patient was not presented at a pre-therapeutic tumor boards, etc. Okay, hold on. So in this benchmarking report from 2021, below you find the link where you can download it in English. It contains the results of 284 certified breast cancer locations in 2019. It has the aggregated data for around 335,000 patients with a first diagnosis. There's a type of breast cancer, of course, not prostate cancer. It has the results of 23 indicators. And as I mentioned already, it shows the development over the course of time. How is the audit organized? We have a partner company which is called Encore. They organize the audits. So there's always an audit plan. And the auditors are oncology specialists with a specific further training for conducting audits. And it's always going to be a tumor-specific auditor. So for breast cancer center, there would be no urologist doing the audit, but it would be a gynecologist who would come to audit the center. The duration of the audit and the number per auditors, it really depends on the size of the certified centers. But interesting is the task of the auditors. So before the audit, the auditors do a plausibility checking of the completed catalog of requirements and of the completed data set. And sometimes they ask some further questions to the center to give some further explanation. And then during the audit on site, they verify the provided information. So they do that by meeting the different departments, asking questions, and also looking at randomly chosen patient files to see if it's all correctly documented and according to the guidelines. And then afterwards, that's one of the most important part is everybody sits together and they discuss measures for quality improvement if needed. And afterwards, the center is getting the audit report, which contains the recommendation if the center should be awarded the certificate, yes or no. So, do you have any questions so far before I show you some of the results?
Друзья, если есть у кого-то вопросы, задавайте. Сейчас мы с вами поговорили именно, как все организовано, каким образом проверяется, собственно говоря, как сертифицируются центры, да, то есть смотрят на показатели качества. Такой аудит проводят специально обученные специалисты, причем эти специалисты, они именно являются специалистами в этой области, те онкологи, которые занимаются этой онкологией ежедневно самостоятельно. Да? То есть если сертифицируется центр рака молочной железы, то его будет сертифицировать тоже специалисты, которые в таких центрах работают, во-первых, то есть они практические врачи, которые приезжают сертифицировать, то есть они понимают, как функционирует это изнутри, во-первых, и во-вторых, они еще проходят специальное обучение. Компания, которая их обучает, называется онкоцерт. Вот, то есть немецкое раковое общество, оно как бы подключило независимую компанию для того, чтобы оно проводило именно аудит на основании вот этих вот параметров, которые они определили, которые являются параметрами качества. Okay, just resume some Russian a little bit.
Можно, может, не совсем про сертификацию, а именно вот по пациентам. Они попадают в определенный центр по региональному признаку или могут выбрать себе в любом городе? Вот у нас, допустим, ты в Ростове, тебе там поставили рак или там сомневаются, а ты можешь поехать в Москву или в Питер, там куда-то там в Германию, и у вас это четко в какой-то определенный центр по региону или нет?
Я задам, I translate in English. The question is if some patient has diagnosed with breast cancer, so it's important to, or it's have a possibility to choose between different centers, between different centers in different regions. So if some patient has diagnosed and live in Berlin, for example, and he want to treat in München or in Hamburg, can have a possibility to choose the center, or is only for this area?
Thank you for that question. In Germany, patients are allowed to choose whichever center, whichever hospital they want to go to.
Thank you.
So that's in the German healthcare system that is possible and foreseen.
So in Russia, I think maybe Vita, you can say how it is situation in Russia. Вы по-английски можете сказать или перевести?
Вы переведите.
Окей, I translate in Russia. Вот интересно было бы узнать, я думаю, Елен, как ситуация в России обстоит с этим делом. То есть может ли... Ну, вы поняли, что в Германии пациент может выбирать.
Я же это сказала, да, у нас пациент может выбрать, в принципе.
У нас тоже может выбрать.
Да.
Окей, in Russia is the same.
Okay.
И тоже еще вопрос. В каждом центре существует там своя какая-то амбулаторная карта, которую провели там какие-то исследования, анализы. Эта информация единая для всей системы центров в Германии или у каждого это своя? Просто у нас сейчас пытаются, ну, теоретически внедрить общую систему, в которую будет загружаться информация по каждому пациенту, чтобы ты в любой точке страны открыл и узнал, что там с ним было.
В Германии еще этого нет, но я задам этот вопрос. So the question is if the patient have some examination in one center and he goes to another one, for example, could this another center have if some big data center exists, where the data from the patient exist, yeah, and another center could get this information from this Николай, может, поможете мне с переводом? Из слайд.
Из этого облачного центра, да,
The question is the following: is there any unified medical card that can contain information from different centers and aggregate all the results?
We really wish there would something like this would exist in Germany, right? But unfortunately, we're not yet that far. They've been working on that for years. So no, it does not exist. How is it in Russia? Are you already further? Do you have already something like that?
We far from that, but we want.
Если в России такая система, но вы сказали...
А как бы хочется, ну, в смысле, что она теоретически должна, вот ее будут внедрять, но пока нет, да, еще.
We don't have such unified medical card at the time, but Vita says that it is in progress. It is in development right now.
I'm sorry, it's not truth, but we have different systems. Special medical systems in different countries, different regions. For example, in some regions we have systems, and every doctor in every hospital can check information about a patient, can check his mammograms, for example, histology, and all information about it with DICOM format. Yeah, and it is not in all Russia, I mean, but we have such a systems. And I have a question too. How many patients we need to have, or how many operations we need to conduct to get through with certification, and how much can it cost for private centers?
Thank you very much for your question. So the minimum case number depends per tumor entity. For breast cancer centers, it's 100 a year. And in regards to the costs, it really depends a little bit on the size of the center. So let's say the pure certification cost, when it's like, so usually for first certification, it's 2 auditors coming for 2 full days, including preparation, processing, audit report writing, and certificate. It's around about 10 to 15,000 euros, plus the travel costs.
Thank you very much.
Можно еще задать последний вопрос? Или я вас, Маргарита, перебила? Вы хотели еще что-то спросить?
Нет, Маргарита.
У меня вопрос. Вот все это, и диагностику, и лечение, реабилитацию, психолога, это все в одном центре оказывается пациенту, такая помощь?
Сергей, do you want to?
Sorry, Nikolai, you can if you like.
Vita wanted to clarify if all the procedures that you mentioned, treatment, diagnostics, maybe psychological, rehabilitation, all these procedures conducted in one center. Vita, am I correct?
Yes.
Yeah, that was the question.
No, or yes. Well, you should not think center as one house, one hospital, but you should rather think a network. So it could be that, for instance, rehabilitation is usually in Germany never included in the hospital. It's always outside. But then you, in order to fulfill the requirements, you need a cooperation agreement. That's what we call it, like a contract where we say, listen, we work with them, and we send them our patients, and they send them back to us in case needed.
Thank you.
Okay, so maybe if you allow, I would like to show you now why certification actually helps to improve the oncological care, and show you also some studies. And then afterwards, I'm happy to answer some more questions. So basically, by setting up networks where the healthcare providers treat the patient with verified high-quality medical expertise, helps the patient or ensures, guarantees the patients that they are in good hands. So every partner of the network has to prove, has to show that they have high expertise, so that they fulfill the training standards, that they fulfill the minimum numbers, that have all the education that is needed. Secondly, through the certification program, the evidence-based medical guidelines are implemented and the broad application is ensured. So like I showed you from the guideline, indicators are derived and implemented documented in the certified centers. And thirdly, through this documentation of data, the quality of care in the individual center is recorded and analyzed annually. It is reflected in the audits and discussed, and if necessary, suitable measures are defined for improvement. And through this, a so-called plan, do, check, act cycle from the project management has been or is being implemented in each certified center. So it's a plan, do, check, act. So first they document, then they check it in the analysis, then they define what to do next, then it's implemented in the certified centers, and then everything starts again because every year there's an audit. So then let's have a look at some of the results. Certification improves the quality of care for oncological patients by improving the overall survival, reducing hospital lethality, and also follow-up resection rate. Here's an example from the breast cancer centers. It was an analysis with data from the cancer registries. Almost 4,000 patients with non-metastatic breast cancer were included. And the summary stated that patients that are treated in a certified breast cancer center, CBC, had a hazard ratio of 0.7, and the treatment of breast cancer at a certified breast cancer center improved the prognosis of the patient. Below you always find the link to the article. Some are in English, some are only available in German. Another example from the breast cancer centers is here it was an analysis of 17 breast cancer centers who were certified between 2003 and 2007. And there was a comparison of before and after the certification. And the study showed that the guideline adherent therapy and the overall survival was improving after certification. So significant higher guideline adherence, therapy after certification, and higher 5-year overall survival. The next one is actually from the colorectal cancer centers. Here it was an analysis with data from the biggest health insurance provider in Germany. 6,000 patients with surgically treated colon carcinoma. And the study showed that the 1 to 5 year survival rates were higher for patients treated in a certified center. 30-day mortality rate was lower, and so was also the follow-up resection rate. And another example for colorectal cancer, here by the means of analysis from the cancer registry, almost 5,000 patients with a colorectal cancer, first diagnosis between 2004 and 2013, and it showed that the 3-year survival rate was higher for patients treated in a certified colorectal cancer center. And the last one I want to show you is for lung cancer patients. Here it was an analysis of the DRG statistic of all hospitals in Germany. 11,000 anatomic resections in patients with lung cancer in 2015. And you can see that the hospital lethality was significantly less in the high volume certified cancer centers for the lung cancer patients. So I'm coming now to the end of my presentation. I hope you got a good impression of how the Cancer Center certification program in Germany works, how it does help to improve the oncological care for the patient by building up the network and ensuring that the guideline content is implemented in a daily routine, that through the certification program, a plan to check X cycle is implemented within the center where they can transparently assess their results and define how they can improve. And also that studies have shown that it does have a significant impact for the patient if he's treated in a certified center. So thank you very much for your attention, and I'm very happy to answer any further questions.
Thank you very much, Ellen, for your very, very nice review. And maybe some colleagues have questions. You just have to write in a chat, or you can ask with a voice as you like, as you wish. And maybe I have a first question. So you told about 100 cases, primary cases for the breast cancer. They need to certificate. Maybe you can tell us what you mean. What is a primary case? What it means?
Now you're asking me quite a specific question. Primary case definition. I must admit that I am not so firm in this matter because my colleagues, my medical colleagues, they are the experts on the definition of the primary cases.
Okay,
but
maybe I can because I'm working for the oncology.
I was hoping you can answer that one.
Maybe I can answer in Russian.
Of course.
If you don't mind. То есть важно то, что сказала Эллен уже для того, чтобы сертифицировать центр, для того, чтобы необходимо, чтобы ваш центр диагностицировал или лечил, правильно сказать, 100 первичных карцином в год. Что такое определение первичной карциномы? Это та карцинома, которая была диагностицирована при помощи биопсии в этом году. Да, то есть мы начинаем вот с 1 января, например, 2020 года и заканчиваем 31 декабря 2020 года. Вот в этот период все первичные карциномы – это те, которые были при помощи биопсии диагностицированы в этом году. Это не значит, что в этом году была операция сделана. Да? То есть, к примеру, у вас была биопсия в декабре 2020 года, а операция уже была, к примеру, в 2021 году. Соответственно, этот кейс считается к 2020 году. Сюда относятся не только инвазивные карциномы, но и карциномы инситу. Вот. И вот таких должно быть 100 впервые диагностицированы в этом году в данном центре.
Сергей, можно еще уточнение? Вот у нас есть часть пациентов, которые уже приходят с верифицированными опухолями. Мы можем использовать, допустим, их гистологические заключения, и они не будут считаться первичными нашими пациентами. То есть они должны прийти условно без жалоб.
Обратиться, и вы должны в вашем центре провести гистологию. Единственное, может быть, исключение, если вы кооперируете, как сказала Елена, это может быть не одна клиника, а может быть 2 клиники. Если вы кооперируете вместе, и вы сертифицируетесь как центр с 2, как сказать, локациями, да, физически, то вы можете это учитывать как общий, как бы в общий, так сказать, котел собирать, и у вас будет всего, у каждого, например, у одного центра будет 70, у другого 30, но в общем у вас 100. Тогда это возможно. Даже я знаю, что возможно 3 центра, но сейчас стараются от этого уходить, потому что тогда снижается экспертиза уже хирургическая. Да? То есть, насколько я знаю, Ellen, maybe I can ask you a question. So, is it possible to certificate three clinic as a one certificated center, or it's restricted?
Of course, that is possible. The important part is that if for us, it's always like the main, let's call it the main partner is where the surgery is happening, especially also for breast cancer. So if either only one location is doing the surgeries 100 per year, or if all three locations want to do surgery, each site has to fulfill the 100 per year.
Okay. Each surgeon or each center?
Each surgical location. Right?
Okay. Yeah. And per surgeon is like, I think 50, yeah? One surgeon
exactly.
should be 50 per year. Okay.
But for every surgical site, right, they have then to meet the 100, or they have to centralize and say, okay, so we're doing surgeries only in this one location, and the other two locations are supporting with other facilities.
Diagnostic.
Еще у меня такое уточнение тоже по поводу гистологии. Вот мы, допустим, выполняем биопсию, у нас на аутсорсе есть компания Unim, которую мы нанимаем для того, чтобы просматривать наши кейсы. Или должен быть штатный обязательно патолог?
Да, я уже отвечу да, но вы можете же по-английски спросить или мне перевести?
Не, могу. Just a moment.
No problem, don't worry.
I speak English very rare, so I'm so sorry for my pronunciation. I ask, is it possible to use outsourced companies for pathology, for example?
Of course.
Yeah?
Yes, of course. You just need a cooperation agreement.
Next part of your question, please.
Second part of my question?
Yes, you ask about the partner,
yeah, we have partners who conduct for us all pathological services, and so we don't have a
pathologist, yeah.
Thank you. We don't have pathologist in our clinic, and yeah, we have a lot of partners, for example, for лучевая терапия,
chemotherapy,
radiotherapy.
Sorry,
for radiotherapy, yeah. And is it possible to certificate us with our partners with two clinics, with pathologist and radiologist?
Yes, that is no problem at all. I mean, your partners then also have to fill out their chapter in the catalog of requirements, and you need to have a contract on which you're agreed to work on, but you probably have that already. And it's no problem. There is no limit to how many partners you can have. It could also be that, you know, every discipline is in a different location. That is no problem. So you can work together. But can I be curious, where is your location? Where do you work?
Yeah, I work in Moscow, Ilinskaya Hospital. Yeah, we are a private center. With breast department. I think we have all kinds of equipment, all kinds of specialists, including psychologists and who else? Palliative therapy, chemotherapy. We don't have only our own pathologist and radiologist. So other doctors, they are here.
Yeah, but that is really, it's no problem. We do have already some experience with Russian clinics. We do have already one certified colorectal center in Samara. But they are like one oncology hospital, so they do have everything on site. But in Germany, it is very common that there are several external partners, and so from the structure of the certification system, it should not be a problem.
Oh, okay. Thank you very much.
You're welcome.
Thank you. But I thought before that Unim, as I know, this is a provider of some services in pathology. They do they have own pathologists?
Yes, they have a lot of doctors around the world, and the main problem is, I think it will be it will be very difficult to explain. Сделать вырезку, я не знаю, как перевести на английский.
So to make
it pieces
a digitalization, I think it is a digitalization of a pathology. So
Tissue.
Digitalization, наверное, I don't know, but to make pieces, special pieces for
to cut a tissue.
Yeah. To cut tissue, the one doctor must cut tissue and make a conclusion. So in Russia, it's a rule, I think, and so we work with doctors only in our city, but we can send digital pathology to other doctors in other countries, and as a second opinion, I mean, yeah, to use this program. I think they work around the world. Unim.
Okay. So it's possible.
It is.
I thought it's not, because as I know, the Unim is a digital solution, but okay. So you don't need one physical pathologist. Nowadays is everything possible with digital solutions.
Well, I think there's one. I think what we do not allow is tele frozen sections, right? So this has to be, it has to be on site, but I'm not a real expert.
That was I mean, because I think is very special with this Unim digital pathology. I think you have to have, but I'm not sure.
Well, it cannot, or let me think. We had that question recently. It cannot be done by a pathology assistant. It has to, the frozen section has to be done by a pathologist, by a trained pathologist, and then it can be analyzed digitally. That is fine. But I think the problem was in Luxembourg that they do not have enough pathologists to do all frozen sections, and they're sending the assistants. And I think that caused the hiccups. But we're in such nitty-gritty details now. I think that is something what we always do is also we adjust to the country-specific healthcare systems. So if we see if there are some requirements which are typical German or just not applicable for the different healthcare systems, we do make amendments. We find equivalences. What I do remember from Samara, when we were discussing with them, because they wanted to become a certified breast cancer center as well, or they are in the preparation, was the matter of which color to use for the sentinel nodes, which if they need to use the technetium, the blue or the green one. So there was something that was different to Germany, but so that is not a problem to do country-specific adaptations.
Perfect. So, colleagues, do we have some more questions? It's very interesting to see how we do it in Germany, and the Concert and German Cancer Society had a some how to say it, specific parameters in each country. So it's, for example, like with technetium, if you don't have a possibility to make it with technetium, so you can do it with some other blue or yellow, or I don't know, but it's possible to speak about and to find some another possible way for the problem.
Definitely, or maybe if I can share another example where we did some country-specific adaptation was also in Samara, as there is actually the certification program foresees that there is a national screening program implemented so that the patients can go there. And for the colorectal cancer centers, there's no screening system implemented. So we found an agreement. We said, like, okay, Samara has to try, at least in its region, or the hospital has to start initiating and offering that to the patients and finding a way to make it more public and try to get the attentions of the patients coming. Because if there's a national one that's missing, they should at least try to establish something regional or within the city. And that actually worked quite well. They did some really great events and initiatives and could increase their number of patients coming for screening.
Okay.
It was really a pleasure. Thank you so much for having me and giving the opportunity to present the oncological structures in Germany.
Yeah.
Thank you very much.
Thank you, Ellen. Все, всем еще спасибо и до следующих наших вебинаров.